Okay. So, Assalamualaikum everyone. My name is Asad, and I am one of the members of Ehsas Mental Health. We have begun to take a series of interviews in which we will be asking well-known psychologists or psychiatrists basic information about mental health and how to basically increase your own general awareness. But not only that, but to also teach you ways in which you can either identify someone who might need to seek out mental health or just general awareness of how of what these symptoms of certain mental illnesses are. So without further ado, we have Mr. Adam in front of us. Please introduce yourself.
Right. Thank you, Salar. So my name is Adam Kureshi, and I am a clinical psychologist. I have a total of 2 years of experience so far. So what are we doing today, Salar?
Today we're basically going to first start off with just understanding the basic situation of mental health in Pakistan. So I guess that'll be our first question. And then from there on, from going from more of a general base, we'll then move on to more slightly more specific questions like what are some of the most common types of mental illnesses which are prevalent in Pakistan? What are some of their signs and symptoms? And then we could ask for ways in which, at what instance should you actually seek out professional help? And what are ways which you can deal with it on your own, or what are ways in which if you know someone, a family or a friend who is going through this, how can you support them? So we will be going through a series of questions based on these sort of topics. So start off with the first one. What is the prevalent situation of mental health in Pakistan?
Right. So basically, there are a lot of uh, you could say the psychological problems in Pakistan quite widespread. So according to some estimates, around 50 million people in Pakistan suffer from mental disorders, but albeit that number may go underreported. So, if we are to talk about what kinds of mental illnesses or mental disorders are prevalent, we could say maybe there are issues such as depression, substance use, alcohol abuse, schizophrenia, bipolar, and PTSD. So, these are some which are commonly seen here.
Mhm. Okay, great. So because mental illness is very prevalent in Pakistan, but there's also one reason for that is also because there's a social stigma attached to it. So in your opinion, what are the reasons for this social stigma being attached to mental illness?
Right, right. Very important question that you raised here. I feel that there is a severe lack of awareness, especially in our culture. And of course, there's such a large emphasis upon the fact that, log kya kahenge? What will people say? What will people think
Mhm.
about if we disclose that, someone is suffering from mental illness? Somehow it's perceived to be considered a weakness of some sort, right?
Mhm.
Truth be told, people are not wrong to perceive this way because sometimes in this collectivistic society, people do tend to misuse such information against each other. But I do feel that a general lack of awareness is the main thing that contributes to this stigmatization.
Mhm. No, I agree because and it's not necessarily the lack of awareness with their surroundings; it's a lack of personal awareness as well. Because some people will be very hesitant to consider themselves having a mental illness. So, and this which is why they won't really take action. So, I guess accepting the fact that you might even suffer from it is also something which people find very difficult to swallow.
Right,
So,
right.
and so since with this general idea done regarding mental illness, what do you think the people can do to actually tackle the stigma, like on a personal level or even on a large scale level? Okay, what can like the average person do?
Right. So, I think we need to start working on, first of all, we need to start working on a micro level at an individualistic level, right?
Hmm.
And we really need to start by destigmatizing mental health. Only then can we hope to eventually polarize mass opinion.
Hmm.
So maybe perhaps starting with our families and spreading the awareness. I mean, that's the closest people we have access to. I see that there's also a recent trend that the popular media has started portraying such issues, and you get to see a lot of social media campaigns and social media posts regarding mental health. But I somehow feel that's not enough, because the responsibility does mainly lie on people such as us, who, such as you, Salah, that,
Mm-hmm.
people who are educated, well aware of these things, and, people who do not have, or maybe have not got the opportunity to learn about such things. It lies upon our shoulders to actually bring to their awareness. And I think
Mm-hmm.
this initiative that you're taking so far, it's a brilliant initiative, and you're like actually spreading awareness to the masses. So initiatives like this could personally help out, right?
Mm-hmm.
Furthermore, acknowledging and timely acknowledgement of such disorders, so that certain people, individuals who are actually suffering from such problems, it's paramount that they get proper treatment and acknowledgement of their, because in our culture we get to see that people often prefer traditional methods, right? And what happens then is that, as a last resort, people are coming towards psychologists and psychiatrists. And in that case, certain cases get so exacerbated that when they actually come here, come to us, they actually are very hard. They're in a, you could say, a chronic case. So acknowledgement on a timely basis, that also helps in, destigmatizing. So, timely acknowledgement and awareness on our part, that is
Mm-hmm.
basically something that we need to look forward to.
I see, you're right. I was also reading online from a few articles based on mental health, in which the language that we use regarding mental health is also very important. For example, people tend to use, say, mental illness rather than mental illnesses, because they categorize them under one umbrella, which is inaccurate, because they're very different from each other, and they have very different effects on the personality. Not only that, but rather than saying a person suffering from mental illness, you have to say someone is living with mental illness, because suffering, that's doesn't because it's not something you have to suffer from. It's something a person has to live with for perhaps a very large portion of lives, if not the entire lives. So so basically, from what I've learned as well, that the language that you use for mental health is also very important in, preventing a sort of stigma being attached to it.
Absolutely. Absolutely. I mean, as the saying goes, sticks and stones may break my bones, but words may never hurt me. That is just a proverb, but, truth be told, words do have an impact on us. They have a profound impact.
Definitely.
And especially people going through or experiencing or suffering from these mental disorders or mental illnesses, they actually have to go through a lot. And that is to say, that's besides the stigmatization. So yes, words do have an important role to play here.
Exactly. Exactly. So you mentioned that some of the more prominent types of mental illnesses are depression, anxiety, PTSD, schizophrenia. So uh, I just wanted to go through some of the signs and symptoms of some of these illnesses, so that people just have a general awareness of what these sort of things look like, or what you can say a person who is on the path towards such a certain mental illness. So what exactly do you expect to see in them? So let's start off with depression. Like, what are the signs and symptoms of depression?
Right. Right. So there could be varying signs and symptoms of depression. When we talk about depression, there's a prevalent low mood, right? There's a loss of interest in a lot of activities. There is basically a loss of interest. There's a lack of motivation. There's a sudden drastic change in appetite. Either you start eating too much or you start eating too less. And then, of course, your sleep is also disturbed. So there are a lot of factors that you need to account for before you can clinically diagnose someone with depression. But albeit, I'd like to say this one thing, that normally people do tend to feel anxious and low at times. And if you feel that you are suffering from excessive anxiety or depressively low moods, that may be interfering with your day-to-day activities or functioning, which could include your occupational, interpersonal, or other domains, and you are unable to manage these problems, then you might want to consider seeking professional aid.
Hmm. Okay. Now, moving on from this, another very common illness is anxiety. And like there are two main forms of it, a generalized anxiety disorder and social anxiety disorder. What exactly is the difference between them and how do you identify each one?
Right. Again, Salar, assessment is, it takes some time to assess someone before we can actually go off with these labels. And these labels, I believe they exist to help people from the mental health and industry to treat
Mm-hmm.
specific individuals with these disorders. Other than that, you could look at it as a broad term anxiety, right? And when we
Mm-hmm.
talk about anxiety, we talk about symptoms such as elevated heart rate, we talk about hyperventilation, we talk about a sense of impending doom, right? So generally, when we look about this, it's a sense of impending doom about the future, something that's not happened. And
Mm-hmm.
when we talk about generalized anxiety, we're particularly talking about worries pertaining to different topics which have or have not occurred, right? So
Mm-hmm.
that is one way to distinguish between other forms of anxiety. When we talk about social anxiety, it mainly is pertaining to anxiety being formulated when a person is um, specifically getting anxious when they think about specific social interactions. For instance, maybe being in class, maybe attending a public gathering, maybe talking to someone. So it's particularly related to anxiety amassed from social interactions.
Mm-hmm.
I hope that answers your question.
That does give a good idea of what exactly it is. So, another thing I wanted to ask about was that I know a few individuals who've suffered from what you would call an anxiety attack or a panic attack. So it's a very distressful moment for that individual. And often at times, the person who's going through it and people around him are often lost at either what's going on or like how to handle the situation. So if someone is going through the situation, how exactly would you recommend that they are helped, or how should they calm themselves down, or how should the friends and family around them calm that individual down?
Right. So now this can be a very challenging.
Hmm.
I'm sorry, I'm hearing myself. Right.
Oh. Hmm.
Okay. So Salah, this, as I mentioned, can be kind of challenging because one of the foundational rules that is taught to us as mental health professionals is that we cannot offer help or give therapy to those people who do not want it, right? That
Hmm.
being said, of course, there are some cases when we see that desperate help is warranted. And of course, it's not easy to see people you love or people you care about suffering from certain issues, right?
Hmm.
But mainly what we can do is we can be a support pillar for them. We can offer them social support. We can offer them comfort by being there for them, or maybe giving them advice. Because, of course, like I said, you can't force someone to seek out help. It
Hmm.
has to be their decision. So if people are going through these symptoms that you told me about, anxiety or depression, sometimes it happens that people live long enough and people tend to make it becomes part of people's personalities, right?
Hmm.
And then simply asking someone, oh, come on, stop feeling bad, it's not the end of the world, or that's the worst thing you can do, right?
Hmm.
Giving personal examples, personalized examples, and saying, okay, giving certain examples from your life can sometimes be very invalidating for these people because every
Hmm.
individual has different experiences. So again, I would like to emphasize there's only so much you can do. You can offer friendly advice. You can maybe raise their awareness by giving them anecdotes indirectly that perhaps they could seek. not necessarily that they have to seek it, but they could seek out mental health, give them stories, give them success stories about it, and
Mm-hmm.
then maybe is offering a support for them, being there for them, and that could be the best sort of therapy that people can do for their loved ones.
Mm-hmm. Great, great. Uh, Thank you for that. Another question I
Okay,
would like to. Yes.
I'm really sorry. Really, sorry. I forgot to mention there are certain cases where I would say that intervention may be warranted. And when we talk about severe mental mental health illnesses, we talk
Mm-hmm.
about psychosis, or when we talk about extreme cases where there's extreme suicidal ideation, only then is it warranted that external uh, intervention may be taken, because that may warrant hospitalization and institutionalized care. But if it's something milder, I don't think people should push these people,
Mm-hmm.
because they're already going through such a tough time. Pushing
Mm-hmm.
them would actually exacerbate the symptoms.
Okay. Okay. So, thank you for that. I guess that does really help a lot of people with knowing what their role is in regards to these sort of illnesses. So, I guess apart from this, like there are a few other illnesses that I would like to talk about. For example, I know another batchmate that is suffering from an eating disorder. So, can you just elaborate upon that? Like, what exactly what does one mean about an eating disorder, and what exactly does that entail?
Right, right. When we talk about eating disorders, we are talking about a predisposition or a being preoccupied by thoughts of food. And this is not just normal preoccupation, this is excessive preoccupation about maybe counting calories, maybe restricting your food intake, and actually being very worried about these thoughts, right? And then taking steps to reduce or mitigate those actions. So there's actually different categories of it. There's anorexia nervosa, there's binge eating, there is bulimia nervosa, and then there's other specified disorders as well. There's a couple of others as well. So they're distinguished by different characteristics. So
Mm-hmm.
basically, if you mainly have to understand eating disorders, it's basically a preoccupation with either restricting or counting calories, or maybe mitigating that you've had a lot of food. And
Mm-hmm.
it's basically to do with a lot of stress, how people react in stressful situations. They start binging, and it's got different elements to it,
Mm-hmm.
the different categories of it.
Okay. Okay. Uh, Apart from this, it's like another illness that seems to be very, very prevalent is the illness of I guess you can say OCD. Because like often people would make jokes कि यार मेरी OCD है कि मैं हर वक्त ये साफ करो. We're talking about very very minute things and labeling it as OCD. However, it is in fact a very serious illness which people just can't help. So what exactly is what you would call actual obsessive compulsive disorder, and what makes it so serious?
Right. So now, one of the reasons that we face stigmatization is the
Mm-hmm.
fact that people don't respect the labels.
Mm-hmm.
And for the fact that people use phrases such as you know I've heard people use words such as psychotic, or maybe bipolar, or maybe OCD so casually that when someone is actually going through these problems, that they are not taken seriously, right? And they don't even know how to take themselves seriously, because they're like, this is such a casual terminology that's being used.
Mm-hmm.
So that being said, OCD is usually, it was considered part of anxiety-based disorders, but now it has a spectrum of its own. So
Mm-hmm.
when we talk about OCD, we have a preoccupation with a sense of obsessive behavior, and we talk about ritualistic um, behaviors to offset such thoughts. So there's obsessive thoughts, there's obsessive rumination about some stress or something distressing, and then there is a participation in behaviors or let's just say, ritualistic acts to offset that behavior. So let's just say someone is distressed about something and they might spend 30 minutes washing their hands, maybe taking five hours in the washroom taking a bath, or maybe constantly checking doors, locks, windows, the gas valves in their homes. So there's different kinds of obsessive compulsive disorders. It's a spectrum. So basically, if you want to put it in a nutshell, it's obsessively intrusive thoughts and then partaking in ritualistic behaviors.
Hmm. I see, I see. And alongside OCD, you mentioned another illness that people take for granted very easily or misuse its labels, and that was bipolar disorder. Now, I personally know an individual who does suffer from bipolar disorder, and when I talk about this individual to other people, they often don't know what exactly bipolar is, because they have a very misunderstood understanding that it's just one person who has like two different personalities, or someone who just acts very differently from everyone else, but they don't exactly know what it is. So what exactly is bipolar disorder, and how exactly is it defined?
Right. So you're absolutely right. A lot of people do tend to mistake bipolar disorder with the polar behaviors. So they tend to say, okay, okay, this person is acting on one extreme, and then on the other day they're acting on another extreme, which is again a misuse of the word. When we talk about bipolar disorder, we are specifically referring to a mood-based disorder, right? And basically, when we talk about bipolar disorders, these are we could call them these are medical disorders, because there is definitely something, a sort of a chemical imbalance in an individual's body that is causing them to have either an excessively elevated mood or maybe an excessively low mood, which we could call a depressed mood. So these individuals, they actually have phases in their lives. Either they'll be going through a high phase or they'll be going through a low phase, or maybe they could be rapidly cycling through these phases. And what becomes critical for these people is because either when they're in a very high state, they might partake, they might become very impulsive, they might partake in a lot of activities, and that may contribute to the stress factor itself. That may exacerbate the conditions, right? And then we talk about the low phases where a person feels depressed, and then there's suicidal ideation. So that entails a whole plethora of other problems as well.
Hmm.
So basically, when we talk about this, there's basically a lot to do with the mood.
Hmm.
So that's how you can distinguish between a bipolar disorders.
I see, I see. uh Moving on, there was also another mental illness which I wanted to touch upon, and that was PTSD, post-traumatic stress disorder. And the reason why I want to touch upon this is because people usually associate this with people from soldiers who are coming back from war, or something war related. However, that's really not the case, and any individual can actually go through trauma, and it's something that people really don't realize. So, what exactly do you define as PTSD, and what are some, can you give some examples of some certain types of trauma which aren't necessarily war related but can also cause PTSD?
Right. A very important point that you mentioned. When we talk about PTSD, again, to understand PTSD, you have to understand that we human beings have this startle response system, which sometimes people call by the name of fight and flight, right? There's a fight, flight, and freeze system in our body. Um, Basically, when a normal person goes through stress, a stressful situation, they are likely to have a acute stress, right? Which could be offset within a month, right? Because if something traumatic happens to a person, to an individual, let's just say there is some sort of a threatened situation where their life is threatened or the life of a loved one is threatened. So they perceive to take that as something, a sense of danger, right? And our bodies tend to react in a way that psychologically and physiologically our body gets, let's just say, revved up.
Mm-hmm.
So it's in a high alert phase, and you are trying your best. Okay, uh, you're super vigilant, hyper vigilant, and you're trying to be aware that this event should not happen again. Now, when we talk about PTSD, this starts to develop after. That's why we use the term post traumatic stress disorder,
Mm-hmm.
right? So it normally happens after, within 6 months, or it could be later as well. It could be a later onset of this disorder as well. So people coming back from wars, they do suffer from PTSD because once they're in the war zone, they are partaking. Maybe they're getting shot at. Maybe they're shooting other people. There is a constant sense of danger, right? But at that time, your adrenaline, your body is matching these situations, and when they come home, things tend to become normal, right? But those memories, they are still processing because PTSD is mainly caused by, let's just say, it's a cognitive factor that our brain stops processing these terrible or disastrous or catastrophic images or these events in our mind. So at that time, when our brain stops processing them because we distract ourselves, these memories come back to us, and then they come back to us in bits and pieces. That's where people start to dissociate. That's where people start to have flashbacks, and then they become very distressing because people are running away from these. They don't want to face these distressing events. Now, the different types of traumatic stresses, we can say people who have undergone a sexual harassment, maybe sexual mistreatment, maybe childhood traumas, maybe, as I mentioned, someone's life is threatened, or someone is in a life-threatening situation, or maybe someone they know who has been in a life-threatening situation. All of these can exacerbate and actually trigger a post-traumatic stress event in a person. So
Mm-hmm.
these things, all of these things, they activate and they may trigger a post-traumatic response.
Hmm. I see. I see. That was very, very insightful because often PTSD is something that's very, very misunderstood, and people really don't understand what's going on with it. And I guess just one final illness I would like to talk about, and this would be considered as the traditional type of mental illness, and that's schizophrenia. Because normally, when someone associates mental illness, they usually think of the
Right.
symptoms of schizophrenia. So, what exactly the reason why I want to touch this on the very end was because it's something that, let's just move over. I want to separate this from other illnesses so we can actually know that there are other illnesses first. And then, after
Mhm.
knowing what those illnesses are, then we could touch upon something people are a bit more familiar with, although not entirely, but they have an idea of this a lot more. So, what exactly are the signs and symptoms of schizophrenia?
Right. Schizophrenia. Again, schizophrenia has a spectrum of its own, right?
Mm-hmm.
And it ranges from, let's just say, delusional disorder, brief psychosis, to different forms of schizophrenia, which vary in intensity and duration, right? And of course, there can be certain personality types associated with schizophrenia as well. So when we talk about schizophrenia, it's very important to understand two things: delusions and hallucinations. So when we talk about delusions, these are actually false beliefs that people have somehow assimilated,
Mm-hmm.
and they tend to believe in them very concretely, right?
Mm-hmm.
And when we talk about hallucinations, these are perceptual disturbances. They could be either pertaining to our auditory senses or our visual senses, tactile responses, or anything, right? So these are things that may or may not exist in reality, right? And the other individual, they are actually perceiving them. So it's actually you would say it's actually an interplay of neurochemistry that causes these malfunctions to happen in a person. So let's just say someone is experiencing these symptoms. So it's very likely, that they have a genetic pattern to it, a genetic predisposition to them. And a person with schizophrenia can go throughout their lives without even experiencing such symptoms. But it so happens that it's been shown in research as well that stress has a lot of role to play.
Mm-hmm.
So if a person undergoes a large amount of stress, they are likely to exacerbate and actually unwind these symptoms and open them up. So they might start experiencing them.
Mm-hmm.
So basically, when we're looking at delusions and hallucinations, that's a major way to offset other mental illnesses from what we call schizophrenia-based disorders.
I see. I see. Well, that was actually very interesting. Um, I guess now, since we have gotten a general idea of what different signs and symptoms of certain mental illnesses are, I want to ask you a question that, since I mentioned before that one of the reasons why people don't really seek out mental illness is because they lack a sense of personal awareness as well. So
Right.
personally, how can one identify that they are in need of a mental guidance or mental health guidance, or they might be perhaps suffering from a mental illness and need some help professionally? So what exactly is a criteria that one would, or for just a general idea, okay, at what point should one seek out some a sort of mental illness?
So now, as I mentioned before, um, when you feel that a symptom or a distress or a
Mhm.
stress, a particular stress is actually interfering with your daily functioning, right?
Mhm.
Could be occupational, interpersonal, or any other area of any other domain, right?
Mhm.
And you feel that you are unable to manage it because a lot of people are able to manage their stresses. They have their own coping mechanisms. Everyone has their own coping mechanisms, their strengths. So if you feel you're unable to manage them and they're interfering in your life to a drastic level, I
Mhm.
would say that would be a right time to actually consider going to or seeking out medical or mental health
Mhm.
aid.
I see. I see. So thank you for that reminder. I just wanted to, explicitly have it pointed out so that anyone who's watching the video will specifically know at when they should
Right.
actually seek help. Um, Another situation I would say, which is a bit unique towards, especially last year, and might be continuing on this year, would be quarantine because of the COVID-19. So quarantine has brought in about a lot of, it seems to be a very stressful situation for a lot of people, and it's also very difficult to cope up with, especially being in your house alone for a very long amount of time. So what do you suggest are certain ways in which someone can cope with quarantine?
Right. Right. But the quarantine situation is hard for everyone, Salar, and certainly been unexpected. So, um, you know, because of this quarantine, a lot of people had been forced to they actually had been forced to stay together and spend a lot of time together. And
Mhm.
that in turn started causing a lot of problems on its own because people forgot about they were not engaging in their daily routines. There was a sense of pandemonium about what's going to happen, worries about whether what they're going to do, loss of jobs, economic stress, and all those other things that would normally existing in their daily lives, they came at a standstill. So, in order to cope with, a lot of other mental health professionals have also given guidelines for this, and it is recommended that during the quarantine, you should try your best to try and maintain a routine. Maintaining a routine will at least give you a semblance that life is going on, and of course, um, you need to have people in your house acknowledge that okay, it's a quarantine but it's not a vacation, right? Because
Mhm.
during the start of it, we did notice that spending too much time with family members, it started aggravating these problems because people started having this sense of expectation that okay, this person is home, that means they're not at work. So it's kind of a perceptual thing that
Mm-hmm.
people have this perception about, since and I'm talking specifically about the student population now, that
Mm-hmm.
if someone is at home, that means they're readily available to do other tasks and to help out. On the
Mm-hmm.
other fact, things like um, s- separating your boundaries, having separate times for work, for leisure, for play, these can also help out as well.
Mm-hmm.
So it's very important to maintain boundaries, set schedules, and of course, family time as well.
Mm-hmm.
So, in a nutshell, we'd say, okay, you have to try and follow a pattern you were following in your normal routine. But of course, um, physically you are not mandated to, or you're not allowed to do that because you're in a lockdown. So what can you do? So you have to set your own boundaries, you have to set your own times, and most of all, you have to have a chat with your family and maybe make them understand that, okay, this is for the best, this is for the best for all of us. Because if we see each other every day, we have expectations that, okay, someone is here, they're not helping out during the quarantine, they're not helping out in the daily chores during the times when they're expected to study and do other tasks, it'll
Mm-hmm.
become very difficult. And
Mm-hmm.
there will be infringement of what would you say, um, the needs and rights of different individuals.
Mm-hmm.
So, in order to avoid conflict, it's very important to have routines and schedule yourself and maintain boundaries. These are the main things that one needs to look forward to.
I see. I see. That's very insightful. I think it would help a lot of people who are struggling with quarantine. Uh, but apart from quarantine, when things hopefully do get better, what are some other ways in which, and generally speaking, someone can take care of their mental well-being? And like exercise is one of them, but like what other things can someone do on a general scale without the restriction of quarantine?
Right, right. So, um, I think I'm going to give you some very generic advice. And as you mentioned,
Of course.
exercising one of those things that can actually help you and keep you away from stress. And as you've seen, that most of these mental illnesses, they get exacerbated by stress.
Mm-hmm.
So managing one's stress is key here. If you're able to manage your stress, you can prolong your life, you can live a good productive life, and you can be a healthy individual, right?
Mm-hmm.
So um, maintaining a healthy routine, maybe exercising, as you mentioned, getting enough sleep. During this quarantine, a lot of people, their sleep schedules, they got disturbed.
Mm-hmm.
So people need to realize that sleeping on time and getting a proper amount of sleep is
Mm-hmm.
vital. So people don't
Definitely.
realize it because they're like, okay, sleep is something we can get away with. Maybe we can um, circumvent the process because there's no strict schedule. So it doesn't matter. They tend to neglect sleep as a whole.
Mm-hmm.
But research has shown that lack of sleep causes a lot of problems, and especially in one's later years, lack of sleep can also cause dementia. That's been shown as per research as well. So improve your sleep and do your future self a favor. And of course, it also helps with the cognitive functioning as well. So improve your sleep, eat healthy, eat a
Mm-hmm.
balanced diet. Don't People tend to start stress eating, and people tend to
Mm-hmm.
have either they're too strict with their diets, or either they're too um, easy with their diets. So
Mm-hmm.
eat healthy, maintain a good diet, have good people, good social support system,
Mm-hmm.
people who can offer you positive advice, people who can actually be a sense of positive relief for you. Be in contact with them, meet them, right? And lastly, I would say, gratitude, being grateful for the things you have, acknowledging the things the the events you've had, excuse me, the different, just thinking about different things that you can be grateful of can be such a therapeutic process. And lastly, meditation or prayer of any sort can actually help people, different people out as well. It varies from culture to culture, but of course, there is no set pattern. But these are you would say, as I said initially, it's generic advice that can help
Hmm.
lower stress, and that
Yeah,
is key here. Lowering your stress
definitely.
is the main.
Definitely, definitely. Thank you for that. And I guess we already previously mentioned like that ways in which one can help on a personal level regarding mental illness is, spreading their own set of awareness. And one can spread their own awareness on a personal level by firstly educating themselves regarding mental illness. So I guess it's a very internal process in which one has to actually make their own individual effort towards making a difference in this entire scope. So
Right.
I guess based on your current observation and your experience, what do you see as the future of mental health in Pakistan? And this will be our last question. Eh, Currently, what is the current trajectory of mental health in Pakistan? Is it getting better? Is there more awareness, or is it getting worse? In other words, people are disregarding it even more.
Right. It's a lot of very important question that you raised, and I feel the future of mental health in Pakistan is actually looking bright, considering the high number of individuals. I've noticed that our training in the mental health profession, the amount of um, awareness that is being spread, initiatives such as yours, young people actually advocating mental health. I see around myself. So I do see that it is looking quite bright, you know. Furthermore, most leading higher level educational institutes are promulgating awareness within their students, and it started to act as a snowball effect. So it's slowly gathering momentum, and
Mm-hmm.
I feel it's going in the right direction. That being said, there are some caveats, and I would say there is still some way to go, considering mental health in Pakistan, especially research and infrastructure-wise, is still at an infancy stage. So maybe an interplay between um, policymakers and the masses could actually enable a macro level change. And that is, I think that is something that differentiates us from the developed nations because, of course, they have better infrastructure, they have better awareness. So they actually do start to, do believe um, in the mental health model. Over here, there is a lot of models to compete with. So hence, it's going to take some time, but we are getting there. We are getting there. So it looks good.
Yeah, that's very great to hear. That's very great to hear. And I guess with this, we will conclude this interview. Thank you so much for taking out the time for this interview. And this is a lot of information. I've certainly learned a lot throughout this entire interview, and hope those who will be watching this will also learn a lot as well.